I'm Renee Eckhart, a clinical specialist with Cork Medical, and today we'll be reviewing general application for negative pressure wound therapy and discussing the importance of a bridge dressing. Before we begin with our application, a couple key points to remember is that we have already correctly identified our patient. We've double-checked our physician's order. I have already pre-prepped my workstation, and the wound and peri-wound both have been cleansed per order, and the skin prep to the peri-wound has also been applied per order. To protect the good skin of the peri-wound, we've already applied that skin prep like we said before. Now we are going to window pane with drape. And there's a couple different ways you can do it. You can do a pattern, or you can do strips and work your way around that peri-wound to protect the good skin from the black foam. So typically, when I apply on a wound like this, I will start on one end, typically whatever I could potentially have struggles with. And this particular area on a cossack sacral area can be difficult. So we're just going to lay this down and pull this out from underneath. And that allows us then to flip this forward and apply the rest of it as such. And again, I just like to work my way around that tape to make sure it's nice and adhered onto that skin prep barrier that we've already laid down. And now we have to remove this top strip with the number 3. So I like to take my corner and I'll pop this up, and it makes this top part stand up so I can peel it down easily. And so I would just peel it straight down like that. The last step we do is to remove this white tab. And one last final time, I like to work the edges, that inner edge of that wound, make sure that I've got a good seal so no fluid or exudate can get underneath that drape. Now that our peri-wound has been protected with our drape, it's time to apply our foam. So I've got a pre-cut piece of foam here that we are going to use to put inside our wound bed. The foam should be cut in a size where it covers the entire wound bed, left to right and top to bottom. If you have a deep wound and you need to double stack your foams, you can certainly do that. I've got another pre-cut piece here. Now you could have these two individual pieces and stack one on top of the other, but you can also do a clamshell method. So what I like doing is cutting the shape that I need at the bottom of my foam, and then a mirror image of that above it, so then I can close it in on itself and insert it into the wound. So I will now have a double stack using one piece of foam. And if you have exposed features such as muscle, bone, tendon, or hardware, you should be protecting those features from the black foam. So we would just put this in here. The fit is snug but not tight, because we don't want to overpack the wound. Now that we have our black foam in, we're ready to cover the whole entire dressing with a piece of drape. And we just peel these out from the bottom, seal it as we go. Then again, I like to pop these corners up to make this top piece stand up. You can feel it even with gloves on. And again, the last step is to peel that off. And again, I typically go around just to make sure that that's really secure in place. And now we're going to go over one of the most important steps, which is cutting the hole the correct size. For the next step, we will be cutting our hole in the dressing using our banded scissors. The technique that I like to use is a pinch-pull cut. I will pinch in the center of where I want my port pad to be. I pull up and make a cone shape with my drape. I cut at the base of that to get my hole. Now this hole is something I see very common. However, you always want to double check the hole size against the hole under your port pad, because the hole that you cut in your dressing should match the hole under your port pad. So we can tell here that these do not match. Well, we can fix that easily with rolling our edges out like so. And then we can come back in and double check ourselves by doing this side-by-side comparison. You can even roll it over so you know exactly that your port pad hole opening is edge to edge over the dressing. So we'll go ahead and we'll do that now. The port pad has these wings, little handles on either side that you can use to help you apply this. Now I like to hold it like this. That way I can watch as I lay that down. And then we use our scalloped edges to peel away the top layer. And then the bottom handles flip out from underneath. So now that our dressing is completely intact, we are ready to connect our tubing that's attached to our port pad to the tubing from the canister. It's a low lock connection. You just set them together and twist them like a 3/4 turn. It only has to be finger tight. It doesn't have to be rinsed down. And so now we're ready to engage the dressing and the pump. And so we've got this nice draw down, and your pump is nice and quiet. Now this dressing was applied to a coccygenital wound. If this was a real patient, we would want to bridge this away. This is completely appropriate for any other part of the body, but since it's a pressure area, we always like to move that port pad to someplace more comfortable, and we're less likely to have any damage to the pressure area that you're trying to treat and heal. And so we'll show you what that bridge looks like now. On this coccygenital wound, you can see that the black foam travels from the point of where the wound location is over to this person's left hip. This is achieved by using one piece of foam. There's one piece of foam on the inside of the wound, and this is one continual piece to make the bridge. So we have the bridge in a landing spot for our port pad. And I like doing the landing spots for our port pads because it allows us to have enough room to cut the correct size hole in our dressing, but it also allows the port pad to rest on there at like a pillow or a platform to protect the skin from any further indentations or irritations. An example of what this would look like not in the dressing is this. Now this is one piece again, but you could very easily do this in two. So if you had already pre-cut your foam in preparation for your application, this could be separate from this piece. As long as the foam touches foam, you're making that connection, and it'll be able to draw that exudate out of the body and into the canister. One thing to note about this dressing, now typically you would not see this outline from a Sharpie, but what we're trying to demonstrate to you here is what this would look like. This is the outer edge of the piece of drape that's underneath all of this. That is the base of your structure. That is our window pane that is protecting that good skin around the wound and on this side of the buttock. Once we've completed our dressing application and we have to document, it's imperative that we document how many pieces of foam are used. So you want to focus on the color of the foam that you've used, the number of each one of those that you've used both inside and outside of the wound. So to summarize your general application for negative pressure wound therapy, we're applying that skin prep, followed by the window pane to protect that peri wound, inserting our black foam cut to fit, covering that foam with a piece of drape, then cutting the hole the correct size, which is going to match the same size as the hole under that port pad, approximately 2 centimeters. Once your hole has been cut to the correct size, you then apply the port pad and connect it to your device.